Welcome back to the deep dive. Ready to explore something kind of mind-blowing?
I am.
Awesome. Today we're going to unpack DAX Copilot.
Ooh, interesting.
It's this AI tool that helps doctors,
Yeah.
spend way more time with their patients
Right.
and way less time on paperwork,
Makes sense.
which, I think a lot of us would appreciate. Because
Yeah.
patients,
Sure.
you've been digging into this, right?
Yeah.
You're kind of our DAX expert for today.
I've done my homework, yeah.
So we've got like a stack of practical guides,
Uh-huh.
even some official documentation excerpts
Oh, wow.
to try to figure this whole thing out, right?
Yeah.
This whole AI and healthcare thing.
It's not just about making notes, though.
Right.
It's like a whole new way for doctors
Yeah.
to use AI
To actually partner with
to
it.
provide better care.
Yeah, to work together with this technology, which is
Exactly.
pretty wild when you think about it.
It is.
So let's just start basic, okay?
Okay.
What exactly is DAX Copilot?
So DAX Copilot,
Is it like a robot?
no, it's not a robot, right? It's
A program.
it's an AI tool,
Okay.
and it's designed to be there, like present,
Yeah.
during patient encounters, listening to the conversation.
Oh, wow.
And then it generates like summaries for medical records.
That's
Like another set of ears in the room, but it's,
trained ears.
trained, exactly.
So are doctors just going to be like
Wait,
talking to a computer now?
no, not at all.
Hey.
The key here is natural conversation.
Yeah.
The documentation we looked at
Right.
stresses that DAX is meant to assist doctors,
Yeah.
not replace them.
Okay, good.
One of the documents actually has a disclaimer in it.
Interesting.
It states that nuanced products, which includes DAX,
Okay.
are not designed to be a substitute for professional medical advice.
Okay, so they're really being careful about that.
Oh, absolutely.
Emphasizing that.
Diagnosis, treatment, that kind of thing.
So it's really about
It's about enhancing
including
user.
human element, yeah.
So how does this actually work, though?
Like in practice?
Yeah, like, do doctors need to, like
Learn a whole new language?
learn to talk differently or something?
It's surprisingly seamless.
Really?
Yeah, DAX is designed to blend into like a normal conversation.
Okay.
But, there are some things that doctors can do
Yeah.
to make sure DAX is capturing
Right.
everything accurately.
Or like what kind of things?
Like techniques, almost.
Oh, interesting.
Optimizing the conversation
Yeah.
for AI.
Okay.
One of them is called
I like it.
multi-factor identification.
Okay.
And it's basically,
Sounds complicated.
no, it's very simple.
Okay.
Doctors are encouraged to say the patient's name and date of birth
Oh,
or their medical record number at the beginning.
at the beginning of the appointment.
Yeah, the encounter, exactly.
Okay, but isn't that something they already do?
They do, but saying it out loud
Yeah.
helps DAX on the back end,
Link everything together.
Link the conversation to the right patient record.
Oh, I see.
Because, especially in busy environments,
Right, where there's lots of patients coming and going.
you want to make sure that,
The right notes go with the right person.
Exactly.
So it's not just recording, it's like
It's actively processing.
it's understanding.
And organizing the information, yeah.
That's fascinating. It's really cool.
Okay, so tell me more.
What about the verbal cues?
Yeah, the verbal cues you were saying.
Hey.
Doctors can.
They can almost like, give DAX hints
Yeah.
by how they talk.
Like a secret language.
That's like a secret language, right?
Yeah.
For working with AI.
I love it.
So, for example, if a patient says,
Yeah.
it hurts here, and points to their knee,
Right.
the doctor can then say,
Right.
so you feel the pain in your left knee.
Oh. Specificity.
Specificity, exactly.
So it's not just knee, it's left knee.
Exactly. And that helps DAX,
Pinpoint it.
pinpoint the location, the laterality.
So it's almost like the doctor's thinking out loud,
Yeah.
but in a way that DAX can understand.
Yes, exactly.
And it's not just pain, right?
Yeah.
It can be anything.
Any kind of symptom, any kind of...
Like if they're listening to the lungs.
Exactly.
Say, I'm
You
gonna-
will listen to your heart and lungs now.
Right.
And that gives DAX, like,
Context.
context. Yeah.
So it's like a much more...
It creates a much richer
Oh,
and
yeah.
comprehensive medical record.
Yeah.
Because it's not just,
Right.
it's capturing everything.
It's not just what the patient said. It's also
The doctor did what they observed.
the doctor's interpretation of it.
Exactly.
Okay, so that makes a lot of sense. But
Yeah.
all this AI listening to conversation.
Yeah.
Like, what about privacy?
That's a big one.
Yeah.
It's, all the sources we looked at
Right.
really emphasized consent guidelines,
Right.
organizational policies,
So they're being careful about that.
very careful.
Like, the patient has to know.
Absolutely.
Informed consent.
It's absolutely. Informed consent is key.
So do they, like,
Sign something every time.
yeah, do they have to, like, sign a waiver every appointment or something?
It depends on the organization and local regulations.
Okay.
But generally,
Yeah.
patients would be told
Right.
about the use of DAX.
Like, as part of their care.
Right. And they can opt out
Okay.
if they're not comfortable.
So there's choice involved.
Absolutely.
So that's good. That's reassuring.
It is.
So, okay, privacy, check. Consent, check. What about just, like, the practicalities
Oh, yeah. Good point.
of recording these conversations? Like,
Right. Where do you put the thing?
yeah, exactly. Like,
How does that work?
does it pick up everything?
Well, there are some tips
Okay.
to make sure the recordings are good quality.
Like what?
Like, don't put the device in your pocket.
Oh, okay.
Put it on, like, a clear surface.
So it's not muffled.
Exactly. Because muffled recordings
Right.
are a nightmare for DAX.
Yeah, it can't decipher it.
Exactly.
Okay, so clear surface.
Clear surface.
Well, what?
One patient at a time.
Oh, so
No overlapping.
no overlapping to
Oh.
prevent,
Right. You don't.
jumbled records.
Yeah, you don't want one patient's notes getting mixed up with another.
Yeah, you got to keep it clean.
Okay, so we've got the basics of what DAX is.
Mm-hmm.
How it works, the practical stuff,
Yeah.
the privacy stuff.
Mm-hmm.
But the real question is, like,
Right.
how does this change the bigger picture of healthcare?
That's the exciting part.
Yeah, let's dive into that in part 2.
Let's do it.
All right, so we're back.
Back for more DAX.
More DAX, bigger picture stuff now. We're
Okay.
talked about, like, how it works, right?
Nuts and bolts.
Yeah, the practicalities, the privacy, all that.
Important stuff.
But, like, what does it all mean
Right.
for the future of healthcare, right? Like, is this a big deal?
Good big deal. Yeah.
I mean, potentially
Yeah.
huge changes.
Okay, like what? Give me some examples.
Well, think about,
Yeah.
reducing the administrative burden on clinicians.
Okay, that sounds good, but
Yeah.
what does that actually mean?
So, doctors spend a lot of time
Yeah.
on documentation, right?
Notes, paperwork, all that.
All that, yeah. And it takes them away from research,
Distance. Exactly.
which is what they want to be doing.
That's the whole point, right?
So DAX could,
It could automate a lot of that
so they have more time.
to actually focus on care.
Okay, but wouldn't that make appointments shorter?
That's a good question.
Because if they're not spending all the time typing,
Right.
they're just going to, rush through the visit, right?
Not necessarily, no.
Okay.
The goal isn't shorter appointments.
Okay.
It's more meaningful appointments.
Okay, so the time they save,
Yeah,
they can use it to actually talk to the patient.
exactly. Have deeper conversations.
Listen more. Really, listen. Build those relationships.
So it's like shifting how the time is used.
It's about quality, not just quantity.
I like that. I like that.
And, another thing is the accuracy of the records.
Okay.
Because DAX is capturing everything,
Yeah.
it's a much richer source of information.
So it's not just like the doctor's scribbled notes.
Exactly. It's more complete, more detailed,
So that could lead to...
better diagnoses,
Oh,
more informed treatment plans.
wow. So DAX is going to make doctors better.
I wouldn't say it makes them better,
Okay.
but it augments their expertise.
It's like a tool,
It's a tool, exactly, like a
All right.
safety net, making sure they don't miss anything.
especially in those like really complex cases.
Yeah, where there's a lot going on.
It's like a second set of expert ears
Trained ears.
listening to everything.
Exactly.
And then there's the data, right?
Yeah, data is a big one.
Like all this information DAX is collecting.
From all these different patients.
Yeah, like what can we do with that?
Yeah. Well, you can analyze it, right?
And then what?
You might find patterns, trends.
That we didn't even know were there.
Exactly. New insights.
That could lead to...
Breakthroughs, new treatments.
Wow. Okay, now we're talking.
This is where it gets really exciting.
Yeah, transforming healthcare. But
Ah,
all this data, right?
tons of data.
It's patient information.
Very sensitive information.
So security.
Big question.
Yeah, how do we know this is all safe?
DAX has robust security measures.
Like what? What kind of measures?
Well, for one, encryption.
Okay, encryption.
All the data's encrypted, both when it's sent
Yeah.
and when it's stored.
So it's like...
It's scrambled, basically.
So even if somebody got access...
You couldn't read it
Okay, so that's good.
unless they had the key.
Okay, so encryption is one thing.
Mm-hmm.
But what about who has access to it in the first place?
Right. So there's access controls.
Okay.
Very strict. Only authorized personnel.
And how do they decide who's authorized?
It's need to know.
So only the people involved in the patient's care.
Exactly. And everything is logged.
Oh, so there's an audit trail.
You can track who accessed what and when.
Okay, that's reassuring
It is. But, some people might still be hesitant.
because it's AI, it's new.
It's understandable. It's a big change.
So how do we, build trust in this?
It takes time and transparency.
So explain the security measures.
Be upfront about it, yeah.
But also, like,
Show the value.
prove that it works.
Demonstrate how it improves care.
Okay, so it's not just about, like...
It's not just about the tech itself.
Yeah, it's about the impact.
It's about the outcomes.
But then there's those bigger questions, right?
The ethical question.
Yeah, like AI and healthcare in general.
What does it mean for doctors, for patients?
For jobs, even.
These are important conversations.
And they're going to keep coming up.
As AI becomes more common.
So DAX is really just, like...
A beginning.
Yeah, like the tip of the iceberg.
It's a glimpse into the future.
A future with AI everywhere.
Exactly.
Okay, so we've talked about the potential benefits.
Less paperwork, better records.
Maybe even new discoveries.
And of course, the security.
And the trust, building that trust.
Right.
But how do we actually know?
If it's working.
Yeah, how do we measure success with something like this?
That's a great question.
And luckily, we have another part to this episode.
To dive deeper into that.
Exactly. So let's explore those metrics of success in part 3.
Yeah.
All right, so we've covered a lot of ground with DAX, right? We have, like, how it works, the potential, even all the security stuff.
Yeah, all the important stuff.
But now I want to know, like, brass tacks.
Okay, I like it.
How do we actually measure if this thing's successful?
Right, it's not just about whether the AI can make a summary, right?
Exactly. Like, there's got to be more to it.
It's got to be about impact.
Yeah, impact on...
Multiple levels.
Okay, so, like, what are we talking about here?
Well, we need to look at the doctors, right?
Okay, the clinicians.
The clinicians, are they happy with DAX?
So, like, clinician satisfaction.
Exactly.
Okay, so you want to, like, survey them.
Yeah, find out if it's actually helpful.
If it's reducing their workload.
Like it's supposed to.
Yeah, because if they hate it, it's not going to work.
Exactly. Adoption is key.
So we asked them, like...
How's it going? Is it making your life easier?
Yeah, but that's kind of subjective, right?
True, so we need objective measures too.
Like what?
Well, we can look at the data.
Oh, okay.
Like how much time are they spending on documentation?
Before and after DAX?
Exactly. If it goes down significantly,
It's a good sign.
it means it's working. They have more time for patients.
And wouldn't that affect appointment length too?
You'd think so, right?
Yeah, if they're not typing as much.
But it's not about shorter appointments.
Okay.
It's about better appointments.
So the time they save.
They can use it to actually talk to the patient.
Really listen.
Be more present.
So it's like quality over quantity again.
Exactly.
But how do we know if that's actually happening?
We ask the patients.
Oh, patient satisfaction.
Patient satisfaction, yeah.
So we survey them too.
Find out how they feel about DAX.
Do they feel like the doctor's more present?
More attentive, yeah.
Even with the AI listening in.
That's important.
But even if everyone's happy.
We still need to know if it's actually leading to
Better health rate.
better outcomes, ultimately.
Yeah, that's the whole point.
So we look at clinical outcomes.
But isn't that hard to measure?
They can be, yeah.
Because there's so many factors.
That affect a patient's health.
Yeah, how do you isolate just the DAX part?
Well, researchers are getting pretty good at this.
Okay.
Designing studies, controlling for variables.
So they can really see.
If DAX is making a difference.
Okay, so we've got clinician satisfaction, patient satisfaction,
Yep.
clinical outcomes. That's a lot.
It's comprehensive.
But we also have to think about, like,
The money.
yeah, the cost.
Right. Healthcare is a business.
So is DAX actually cost effective?
That's another metric.
So we got to weigh the
The
benefits
time saved, the accuracy.
against the cost of the technology.
It's a balancing act.
It's a lot to consider.
It is. It's complex.
But that's the thing with AI and healthcare, right?
It's not simple.
It's constantly evolving.
We have to keep learning, keep evaluating.
So DAX is a big step,
A fascinating one.
but it's not a magic bullet,
No, it's a tool
a powerful tool.
that can help us.
But it's not going to replace doctors.
Or the human connection.
That's key.
So for you, the listener,
Yeah.
think about it. How would you feel
About having an AI in the room.
at your next appointment?
That's a big question.
It is.
But that's what the deep dive is all about, right?
Exploring these questions.
Thanks for joining us.
It's been a pleasure.